video series at the Neurology. Let's discuss strokes. A stroke is a blood clot in the brain leading to loss of blood supply in that area. Stroke, depending on where the blood clot is lodged in the brain, it can cause symptoms. For example, if it's lodged in the cerebrum, it can cause speech issues or what we call aphasia. If it's in the brainstem, it can cause balance issues. So there are lots of symptoms of stroke. It all depends on where the blood clot is. There are two different types of stroke: thrombotic and embolic. Thrombosis is when the blood clot forms in the brain itself. Embolism is where the blood clot comes from either the blood vessels in the neck, the carotids, the vertebrobasal circulation, or the heart. That's why often in stroke workup, you have to check the carotids and the vertebral circulation. You have to check the heart too, because we're looking for the source of embolic strokes. Often on the MRI, we can tell what type of stroke it is by looking at the MRI to see if it's thrombotic or embolic. And then that helps deciding what medicine is best to try and reduce the risk of further strokes. Regarding the medicines, we have the antiplatelet agents like aspirin, Plavix, Brilinta, and the anticoagulants like Coumadin, and the direct anticoagulants, Eliquis, Xarelto, Pradaxa, and others. And I prefer the direct anticoagulants for non-valvular atrial fibrillation. Regarding the antiplatelet agents, the Brilinta is a good choice for people where there might be a resistance to aspirin or Plavix. Too much really to discuss what goes into the thought process of which medication to choose there. Also, an important point is when someone is having stroke-like symptoms, one should go to the ER right away, because they can get the intravenous or intra-arterial clot buster called TPA or tenecteplase, and that's usually done if the patient is a candidate, that is, considered a candidate for a clot buster, but you should be in the hospital with a certain amount of time to qualify for that.